Hello, I'm Beverly from the Midland Public Library, Program Assistant, and today on our Ways to Wellness, we will talk about alcohol, cannabis, tobacco, and other drugs. Substance use refers to the consumption of alcohol, cannabis, opioids, and other drugs. Substance use may lead to substance use disorders, overdoses, infectious diseases, or other complications. Reducing the harm associated with substance use can prevent injury, illness, and death. Smoking tobacco. Tobacco continues to be the number one cause of preventable disease and death in Canada. An estimated 48,000 Canadians die each year as a result of smoking. Countless other lives with chronic diseases, despite public health education and prevention efforts. Approximately 15% of Canadians currently smoke. Did you know there are 4,000 chemicals in every cigarette? Look at our diagram here. Look at the stuff in there. For example, carbon monoxide, arsenic, benzene, ammonia, butane. Here are some numbers behind the smoke and mirrors of tobacco. There are 70 carcinogens in tobacco smoke. That's nearly as many as there are deadly venomous snakes in Australia. Tobacco is the number one cause of preventable disease and death in Canada. More Canadians die each year as a result of tobacco-related disease than due to traffic accidents in Canada and the US combined. There are nearly twice as many chemicals in tobacco smoke as there were people in the Titanic. 3 out of 5 people who experiment with cigarettes will become addicted. Time to quit and Weedless Wednesday. So, Weedless Wednesday, will you butt or doob out for 24 hours? What is cannabis? Cannabis is a plant known for its psychoactive properties. A variety of cannabis products, herbal material, cannabis oil, concentrated extracts, edibles, tinctures, and creams are produced and used for their physical and cognitive effects. People consume these products for medical and non-medical purposes. People usually smoke cannabis, but they can also consume it in other ways, such as vaping and in edibles. Okay, cannabis flower secretes over 100 different chemical compounds known as cannabinoids. When consumed, these compounds bind to the cell receptors and change the way these cells communicate with one another. 2 of the best known are THC, which is the primary psychoactive component in cannabis and is responsible for the high that individuals experience. It has both therapeutic and harmful effects. And CBD, which is the second most common cannabinoid in cannabis. It is not psychoactive and is being studied for its use in medical applications such as relieving pain, anxiety, and chronic conditions. Alcohol. Alcohol is the most commonly used substance in Canada. Understanding the impacts of alcohol use is essential to minimizing the risk and harm. It is also known as ethanol. It is a legal substance known for its psychoactive properties. It is produced by fermenting or distilling produce or grains. Fermenting beverages include beer, cider, wine, and flavored purified alcohol, which range from 0.5% to 20% alcohol by volume. Distilled beverages, often called spirits, include products such as vodka, whiskey, which usually are 25% ABV or higher. Many social gathering features alcoholic beverage. Nevertheless, the consumption of alcohol carries a risk of adverse health and social consequences related to its intoxicating, toxic, and dependent-producing properties. To avoid harm, Canadians who choose to drink should follow Canadians' low-risk alcohol drinking guidelines. Opioids. Canada is in the midst of an opioid crisis. There were more than 11,500 apparent opioid-related deaths between January 2016 and December 2018. These lost lives make the opioid crisis a leading public health and safety concern. Opioids exist in both licit and illicit forms. A variety of opioid medications such as codeine, fentanyl, morphine, OxyContin, and diacetylmorphine are produced and used most often to treat pain. People consume these products for medical, and most of the harms currently are being experienced are due to fentanyl, a synthetic opioid that can be prescribed to patients for acquired illicitly. The presence of fentanyl in other substances dramatically increase the risk of overdose, as it is an extremely potent drug that can cause fatality even in trace amounts. About the opioid crisis. The current opioid crisis is a result of multiple complex factors that include a misunderstanding of the addictive risk of prescription opioids, psychological, social, biological risk factors like genetics, mental health, early life experiences, trauma, poverty, lack of secure housing, and other social determinants of health, stigma towards substance use disorders, frequent opioid prescribing and high amounts being prescribed for pain relief, lack of awareness or access to alternative treatment for pain, use of prescription opioids by individuals to whom they are not prescribed, such as friends and family members, lack of access to prescription opioid leading to illicit opioid use, illegal drugs that are laced with fentanyl and its analog, and a lack of comprehensive care to respond to all of the medical and physical health needs of an individual. Methamphetamine. While the prevalence of methamphetamine use among the general population in Canada is low, since 2013, there have been a drastic increase in the availability and harm associated with methamphetamine in Canada. Methamphetamine is a synthetic drug known for its psychoactive effects. It is classified as a central nervous system stimulant and comes in a variety of forms such as powder, tablet, crystal, and rock-like chunks. Depending on its form, methamphetamine can be snorted, injected, ingested, or smoked. Methamphetamine produces a euphoric high and can be used to increase alertness, energy, and self-confidence. It also produces harmful psychological effects including headache, elevated heart rate, body temperature, hallucinations, delusions. Regular use is associated with an increase of addiction, psychotic symptoms, and cognitive impairment such as memory loss. Methamphetamine is often produced illegally in laboratories and the high risk of explosions. Prescription drugs. About 22% of Canadians over the age of 15 years of age use psychoactive prescription drugs in some form, according to the 2017 Canadian Tobacco, Alcohol, and Drug Survey. There is an urgent challenge to reduce the related harm of prescription drugs while ensuring timely and appropriate access to them for medical applications. This challenge is particularly pressing for opioids, but also for stimulants and sedatives. Misuse and non-medical use can lead to problematic use patterns and negative health outcomes. Engaging in behaviors prohibited by the label, driving or operating heavy machinery, it can have problematic consequences. There is a variety of prescription drugs available on the market, taking the form of capsules, syrups, skin patches, liquids for injection, which are used to help patients' health conditions. On these, the most commonly used varieties that can lead to problematic use are opioids, which can help treat pain, sedatives, which can help relieve anxiety and assist with sleep problems, and stimulants, which can help treat individuals with attention deficit hyperactivity disorder. Treatment, support, and recovery. Treatment, services, and support can help people experience harm from substance use or addictions. Services can include early identification and intervention, harm reduction approaches, and relapse prevention. Services can also include peer support, specialized treatment, continuing care, and more. Some services are available through public health care, while others require private funding, and some are regulated according to standards, while others are not. Understanding that there is no one-size-fits-all treatment option is essential to providing the best possible care. By matching people with the services that fit their needs, they can have a better chance of recovery. In addition, services and support should be flexible, tailored to the needs of the individual to accommodate all people. They should also be acceptable, accessible, and available and affordable. Here is some contact information for the Canadian Centre on Substance Use and Addictions. Here's the address and the phone number. It is a 1-833-235-4048 number. And then, of course, in our local community, we have Chigamik Community Health Centre. It is right here in Midland, and their phone number is 705-527-4154. There's also the Canadian Mental Health Association and other various therapy networks around our area. Thank you once again for joining us on Ways to Wellness. I hope this presentation was beneficial.